Hi, I'm Brad Castellano. I'm a podiatrist. And over the next few minutes, we want to demonstrate a new product to you for the treatment of painful corns, calluses, hammertoes, and lesions under the ball of the foot. Basically, it's a retake on an old product called the buttress pad. We all learned in podiatry school how to make a buttress pad out of tube gauze, a little foam inside, and wrapped with moleskin across the top. Very useful devices, a little too useful in my practice because the problem was I would send patients to the store to buy something that was available over the counter, and they always came back and said, I like the device you made me better than what you sent me to buy. So could you make me one more? And so what we developed was a new product called the Toe Snug. Toe Snug is basically a buttress pad. Here it is. It comes on this card, shows patients basically how to wear it right away. It comes on around the three center toes. And here it is. Basically, this is a device that is adjustable for the patient. You can slide this back and forth and tighten it around the toes. One of the nice things about it is for patients that have spreading of the toes, either the second toe migrating towards the great toe, which you commonly see, or just spreading out of the toes, we can actually kind of gather the toes together with this device, and works fairly well for that. It of course works great as a buttress pad. The foam underneath is there, and then there's a cushion on top to keep the shoe from rubbing across the tops of the toes. This little tab has turned out to be quite versatile portion of this, in that it can be used for hallux malleus to prevent lesions over the great toe. It can be used to folded down in between the great toe and second toe when the patient has hallux valgus and they're getting the lesions between the hallux and the second toe. And it even is been shown to me, patients taught me this, that you can wear this upside down, and if you have a patient who has a lesion under the IP of the hallux, that pre-ulcerative lesion or ulcer under the great toe there, or a callus due to an interphalangeal sesamoid, you can actually flip this device over and wear it upside down, and it helps to treat that as well. So we'll show you that here in the rest of the video, and I hope this turns out to be as useful a device as it has for my practice. So the red markings demonstrate the typical patient that would benefit from a Toe Snug. Lesions between the toes, the little toe here, great toe. Top of the proximal interphalangeal joint of the digits, of course, very common. Hallux malleus, this lesion. Also under the foot, the tip of the toe, in a claw toe type situation. Metatarsal phalangeal joint lesions and capsulitis. And also IPK sesamoid lesions under the great toe. So we'll show, here is the Toe Snug slid on over the three toes and then tightened down. As you can see, it gathers the toes for patients that are complaining about toes spreading apart. It creates a buttress for lesions on the top, a spacer for the lesions between the toes. It also, this long tab, can act as a buttress for the lesion on the top of the interphalangeal joint of the hallux. Under the toe, it helps straighten the toes for a lesion here. Creates more padding for the capsulitis type lesion under the metatarsal phalangeal joint. And lastly, the Toe Snug can be used upside down for patients who have that lesion under the hallux, either pre-ulcerative lesions or the callus due to the IP sesamoid. So this pad can be used to pad the interphalangeal joint region in this area that's very common to have pre-ulcerative or even ulcerations under the great toe. So one final thing that I'd like to show you, for a lot of patients, the bulk underneath the foam that's inserted inside here is too much, or they don't need that, and so it can be easily removed It's very easy to disassemble and reassemble in your office. Basically, this tab again is used to stretch it out where you can pull it completely apart, and then the small notch there that the tail comes out of, you just insert a hemostat in there and grab the foam out, and you simply fold it back, insert your hemostat again, grab the tail and pull it back through. So very easy to assemble and reassemble in the office scenario so that makes it again very versatile for the different situations that you'll see. This is made of Sherpa fleece. It's a washable material that patients can hand wash this and reuse it. Very soft, comfortable for them. In most shoe gear, they'll get away with this device, where some of the other devices are not so versatile, not so easy to adjust and make thin or thick. The device comes again on this card, and on the back side it explains the care and also shows the various conditions that the device can be utilized for. Should be available at most of the medical supply stores that you order from to dispense through your office. Also, there's toesnug.com, and the patient can go there and find a online retailer or hopefully a medical supply store near them that they can purchase the devices. So hope this is helpful to you. It's been very helpful for my patients, I know, and big time saver for me not to have to make buttress pads again in my office. So let us know what you think. Thanks for watching.